Hello, and welcome to the Counseling Formation Program at Hope Family Resources. We are continuing our discussion on the book Psychic Wholeness and Healing by Dr. Anna Terruwe and Dr. Conrad Baars. This is the third discussion in the series on that book.
Hello, Mr. McDonald. I noticed that in reading through the case studies that the duration and frequency of treatment varied among the clients. What factors determine the frequency and duration of treatment?
The first factor that contributes to the duration and frequency of treatment is the severity of the neurosis. Some of these clients come in where their neurosis is in such a profound state where they are bordering on psychosis. And in such a case, the client is going to need to be seen by the therapist much more frequently, and I would say for at least an hour in duration. Some clients whose neurosis is less profound, who have maybe a more moderate level, will need to be seen far less. Another factor would be motivation. One of the beautiful things about Thomistic psychology is that in reading the material, if the client reads the material and has a grasp of the material, the client will be able to derive great benefit from that and be able to apply a lot of the principles on his own if he's motivated. So in a lot of the case studies in the book, you'll find that these people, for example, I'm thinking of the lawyer that was talked about, that he really embraced the principles, and on his own he began applying them. Where some clients aren't as motivated, often intelligence has something to do with it, education has something to do with it, overall temperament has something to do with it. So that's one factor as well. Also the type of neurosis that they're suffering from. For example, if someone's suffering from an hysterical neurosis, as in the first example in the book, the person is going to have to be seen probably once a week because the treatment is psychoanalytic, and the therapist takes a more active role. He'll be probing and interpreting the client's behavior. Whereas in the other types of neuroses, more the client is able to apply a lot of the principles on his own. I think it's said in the book that the client who was hysterical was seeing Dr. Terruwe for an hour every week. But even twice a week would even be more beneficial. However, with something like obsessive compulsive neurosis, unless it's a severe case, that wouldn't necessarily be true. The fourth factor is financial. The clients often cannot afford coming very often. Maybe they can only afford coming once every 2-3 weeks, maybe once a month. So you try to work with the client and come up with something that would still be helpful to the client, at the same time not be such a financial burden. It's important to keep in mind that the clients, because of their neurosis, are dysfunctional in many areas of their lives, and one area in which they're often dysfunctional is in their money management.